Welcome, Scott, at the ICPO Foundation office in Wiesbaden. It is a pleasure to have you with us. You have successfully undergone a treatment for a neuroendocrine tumor with radiotheranostics in the US and in Germany, sharing both the medical and the emotional aspects of your patient journey is a valuable gift for all other cancer patients. First of all, we would like to get to know you as a person. Please tell us where you live, what your profession is, and a little bit about your family background.
I'm 62 years old. I was born in California, and I've been living for the last 25 years in Washington, D.C., and I just recently moved to Bend, Oregon. I'm married with 3 children. I have a son who's 27 and a daughter who's 24 and another daughter who's 19 and in college. I run a small hedge fund that we buy and sell stocks using mathematics and computers. I've been doing that for about 25 years, first 13 years for a larger company, and I've been doing it with a small group for about the last 8 years with a small team of 10 people, which has been really fun. I love my job.
You shared some photos with us, and I learned that you are a very active person. So what is the passion in your private life?
Well, I would say that the passion in my private life is my family. So when I moved to Bend, one of the reasons for moving to Bend was to be near my son. He lives there also. As far as other activities, I like to do lots and lots of stuff outdoors. I like hiking, I like biking, kite surfing, snowboarding, and my current most intense passion is pickleball. So I started playing pickleball about 3 years ago, and I am fully addicted. So I play at least 2 hours, sometimes 4 hours a day. So it's a amazingly fun and social sport, and yeah, it's a huge part of my life right now.
Can you describe how you found out that you have a neuroendocrine tumor? Which symptoms led to your diagnosis?
So when I was first diagnosed, I was diagnosed with pancreatic cancer. So that's all I knew, and so I was very, very sad, worried, scared. All those things. It took me about 5 days to get into the hospital at Johns Hopkins to get an appointment. And so when the doctor there told me that he thought it was a neuroendocrine tumor and not an adenocarcinoma, I was actually very excited because I thought it was adeno, and adeno is, as everybody knows, very bad. And neuroendocrine is not great, but it's a lot better than having adeno. So it was sort of a mixed bag. I had been so scared beforehand that by the time I got the neuroendocrine diagnosis, I was thrilled. So it was a very weird transition.
Why is it so important to ask for more treatment opinions from different doctors when you have a neuroendocrine tumor?
So as I said before, when I was diagnosed, I thought it was they thought it was a adenocarcinoma, and it turned out to be neuroendocrine. So my doctor at Johns Hopkins proposed that he wanted to do surgery, but that at the time the surgery was too dangerous because there was a lot of vein involvement in my tumor. So he wanted to do external beam radiation as the first treatment to hopefully make the tumor smaller, and then he would be able to do the surgery. After talking with him about that and doing some research, I realized that nobody does external beam radiation on neuroendocrine tumors. And in addition, when I talked with the radiologist, he couldn't give me any data on the likelihood that it would be successful. So I was disappointed. So I then went to Memorial Sloan Kettering and got a second opinion from them. They have a medical oncologist who's an expert in neuroendocrine tumor, and she suggested doing a chemotherapy, hoping that it would make it smaller and that then they would be able to do the surgery. But the surgeon there was adamant that you could not do surgery right now. It was way too dangerous because of the vein involvement. So after hearing these 2 opinions, I thought, well, I've gotten 2 opinions. They're both really different. I should probably go someplace else, see if I can find some consensus. So I went to a hospital in Virginia Beach to talk with a friend who was an expert in neuroendocrine tumors. I went to Vanderbilt, they're experts in neuroendocrine tumors. I talked with somebody in Iowa because they're experts. And they all gave me different opinions. And so then I was going to Stanford for a scan, and my sister actually posted something on a website saying, has anybody been in the same situation that I'm in? And somebody suggested, well, you should talk to the people at Stanford because they do surgeries in dangerous situations. So I went to the surgeon at Stanford and he said, I can do it. And the reason he could do it was because he does the GI part of the surgery, but he has a vascular surgeon come in and deal with the veins, which is the dangerous part. At Johns Hopkins, they just have a GI surgeon. He does it all because he thinks he can. So at Stanford, they were very convincing that they could do it, that it was more dangerous than a normal Whipple surgery, but that it was doable. So I had my surgery done at Stanford. I had my whole pancreas removed, as well as my gallbladder and my spleen and a couple other things. I spent 17 days in the hospital, and they fixed my veins in a unique way, such that the doctor at Stanford, the vascular surgeon, when I talked with him after the fact, he came in and I said, he described what he'd done, and I said, well, have you done that a lot? And he said, I've never done that before. So anyway, it was an amazing outcome. So, and I'm very thankful to Stanford that they were willing to do it.
You told us that your sister was the most active person to find the best treatment for you. How did she hear about radiotheranostics?
So when I was first diagnosed, my sister and my wife and I made the decision that my wife and I would focus on me and my mental health and staying positive, and then my sister would do all the research. So I was not allowed to go on the internet. I was not allowed to do any research. She did everything. Literally, she drove my care. I did the organizing with the plane tickets and the hospitals, but she decided what we were going to do. And right after I had my surgery at Stanford, we met Dr. Fisher, who's my oncologist at Stanford, introduced me to Josh Mailman, who also has a neuroendocrine tumor and is basically a patient advocate in California. And so I was introduced to him. Coincidentally, my wife knew someone in Washington, D.C. who was in a book group with her who worked for SNMMI, which is a nuclear medicine organization in the States. And Josh and this woman, Bonnie, know each other. So I heard about PRRT early on from both Josh as well as from Bonnie.
Your patient journey has been challenging, involving a difficult and life-threatening surgery. Could you walk us through the different phases of your treatment process?
So when I was first diagnosed, everybody I talked to, pretty much everybody said, you need to have surgery. You have to get out the primary. So that was our focus for the first 4 months, was how to find someone who could do the surgery, who was willing to do the surgery. So I got that at Stanford, and after the surgery, the doctor proclaimed that there was no evidence of disease, and I was clear, and that lasted for about 6 months. And then they found some small growths in my liver. And so I tried a variety of different things for quite a while. I did some chemotherapy that the person at Sloan Kettering had suggested, which is very common for neuroendocrine tumors. I had a liver ablation. I tried a few other things. And then when it seemed like nothing was really working that well anymore, I did PRRT in the United States. It had only recently been approved in the United States. This was right during COVID. And so I did a PRRT in the United States. I did 3 or 4 treatments. It worked for a little while. But after about 6 months, things were starting to grow again. And that's when I came to Dr. Baum. So I found out through Dr. Baum, well, I'd heard of Dr. Baum before because I was friends with Josh Mailman, and I was friends with Bonnie Clark, who works at SNMMI, and they both know Dr. Baum well. And then my oncologist at Stanford was Dr. George Fisher, who also knows Dr. Baum. So when it seemed like this was the right route to go to try and go see Dr. Baum, I think Dr. Fisher introduced me, but Josh really drove the process. So Josh has quite a close relationship with Dr. Baum, and so he is the one who really helped me get in, get an appointment, and get to see Dr. Baum the first time. Okay, so I started with Dr. Baum. I first came to see him in October of 2021 with my wife. I remember being very nervous. At the time, I was feeling like things were really going south. So I had had a conversation with my son where he had asked me to be honest about how I was feeling about things. And I told him that I was pretty scared. And so I came to see Dr. Baum, and he did the scan. And I remember going into his office and him saying, yeah, we can treat this. The scan that he did looked dramatically different from the scans that I had gotten in the States. In the States, the scans looked like there was a lot of growth, but it didn't look that bad. The scan that Dr. Baum showed a lot of growth on my liver. At that time, I was actually, maybe for the first time ever, experiencing symptoms from the cancer. Though I'd really never experienced any symptoms, but I had right shoulder pain, and I also had pain in my upper right quadrant, which is related to the liver. So it was a bad time. Well, he said he could do it. He told me to come back in a month, which was on the day before Thanksgiving, which happened to be my mom's birthday. So I came back by myself and spent Thanksgiving in Germany. Of course, they don't celebrate Thanksgiving in Germany, so I had Thanksgiving dinner by myself, but I got my treatment. So I had one treatment then, went back to the States, waited 2 or 3 months, came back for another treatment. Scan showed that things seemed to be working. Got a second treatment, came back again. 3 months later, treatment is still working, actually working quite well. Then I came back another 3 months later, ostensibly for a fourth treatment and a scan, but the scan was so good that Dr. Baum did not think that it was necessary to do another treatment. He described me at the time as being a super responder, but it's dramatic. I mean, my whole liver was covered in tumor when I started seeing Dr. Baum, and by the end, it was hard to see any growth at all on my liver. So it really, from my perspective, my family's perspective, it was a miracle. I've continued to see Dr. Baum over the last few years. Occasionally growths will pop up now and again, and I come back and I get another treatment for him. I text him, I call him, or I email him, and he gets me in, and I come for a treatment or two, get a scan, and then go home. Sometimes I come just for scans. So I've been in Germany a lot.
You're medically supervised by Dr. Fisher from Stanford Medical Center in the US and by Professor Baum from Prognostikum in Wiesbaden in Germany. Why are they the perfect match for you?
I would say yes, they are a perfect match. So they know each other, they're friends, and obviously colleagues, and they communicate back and forth. Dr. Baum sends my reports to Dr. Fisher, and vice versa. I communicate with both of them and send texts back and forth if they're not actually texting back and forth. And I would consider both of them to be not like personal friends, but I have personal relationships with each of them. And I like both of them a lot. I think Dr. Fisher is probably frustrated that he can't do what Dr. Baum can do right now because of the United States FDA, but he's happy for me. I go see Dr. Fisher 2 or 3 times a year, as well as Dr. Baum 2 or 3 times a year. I get a scan with Dr. Baum and I get a different scan with Dr. Fisher. And they both look at the the opposites scans to see what's going on. So yeah, it's been a great, I feel like I have a really good team right now.
What is your personal experience with radiotheranostics concerning side effects?
I have no side effects from radiotheranostics. The only thing that I might feel is a little bit of fatigue for maybe a week afterwards, but even that's hard to say because I travel to Germany, I get my treatment and I go home, so it could be jet lag. It's not even necessarily from the treatment. So I had my treatment just recently and I feel totally fine. So no nausea, no GI systems, no appetite issues. It's so much easier than chemotherapy or anything else I've had done. It's so simple.
What was the emotional impact of undergoing this cancer treatment? How did you cope with your fears and uncertainties?
That's a hard question. So when I woke up from my surgery, I was very happy that I was done with the surgery, but I was not myself at all. And my sister likes to say that we saved Scott, but we lost who he was. The 2 weeks, 3 weeks out of the hospital, it was still bad. I just was feeling bad. I wasn't happy. Just didn't really want to do anything. And I mean, the surgery, it was a big surgery. So it's hard to differentiate the having cancer versus the potential blood chemistry issues associated with having such a major surgery and lots of organs removed. So I think eventually I realized that I was pretty depressed. And so I went on some antidepressant drugs, and that really changed the game for me. So I'm still on them today, but I remember very vividly, and I had my surgery on April 30th. I remember very vividly in late June, sitting around playing a game with people and thinking to myself, I'm actually happy right now for the first time since the surgery. So should not be minimized that there's a strong mental, emotional component of any of this, and you need to be, you need to try and get ahead of it. So I do lots of things during the day to have things to look forward to make sure that I'm happy. So I think before all this happened, I was naturally just a happy person, and now it's more of a struggle to be a happy person all the time.
Do you think that depression could also have arisen from surgery and the changed distribution of hormones? Would it be important for doctors to point out the development of a mental illness after such a treatment?
It's very important to discuss it beforehand. So I was totally on my own. So I was with my family, and I was miserable. My wife was scared to leave me alone. It was a bad time, and I eventually talked with a psychiatrist who basically said, "I think you're depressed." And then she prescribed some medication for me, and it was amazing. It takes a while for that medication to kick in, and then after about 3 weeks, all of a sudden things just started coming back together again for me. So not that I don't still have struggles, but I do things that I love to do. I play a lot of pickleball because it makes me very happy. I hang out with my family because it makes me happy. I don't do stuff that I don't want to do anymore. I only do things that I like to do, and I look forward to getting up every day.
Dr. Fisher introduced you to Josh Mailman, an international patient advocate. How important are patient groups and cancer networks for you?
I do have looked at some cancer networks. So I use Inspire, which is a website that has a very active neuroendocrine tumor group. So I find that very useful, and that's actually where my sister found out that that at Stanford they were willing to do surgery on people that were higher risk. So she posted a question on that, and somebody answered immediately and sent her a paper that my surgeon had written about. He called it surgery on the non-surgical or something like that. Surgery of the unresectable or something like that. So that was very useful. But I'm not really a patient group kind of person. So I have my family and my friends, and they're my group. I do spend a fair bit of time talking with others who were recently diagnosed with almost any kind of cancer. So obviously all my friends know that I've been through this very long journey. And so everybody seems to think that I have some wisdom to impart. So I do 1 or 2 calls every month with people who have recently been diagnosed with some kind of cancer. So oftentimes it's, maybe half the time it's neuroendocrine, but a lot of times it's something else. And they just want some advice on how to navigate the system. So I always say you should get multiple opinions.
How has the treatment impacted your daily life?
So I would say the PRRT treatment that I get does not impact my daily life at all. The only thing that impacts my daily life is having to travel to Germany, which I don't actually mind too much. But one of the big issues with having cancer that you have to treat for so long is it just takes a lot of time. So I spend, a not insignificant part of my life talking to my doctors, sending my scans around, organizing travel plans, just making sure I am on top of it. I get my blood drawn every month. So it's just, it's a 5 to 10% job just managing my sickness. But it doesn't impact anything that I do.
What advice would you give to someone who has just been diagnosed with a neuroendocrine tumor or is considering radiotheranostics as a treatment option?
So, my number one advice for almost anyone who's been diagnosed with cancer, but particularly for neuroendocrine, which is more rare, is to get multiple opinions. So even if you like the first one, get a second one. As in my experience, they did not coincide. And even after I got 3 or 4, lots of them didn't coincide. So I think it's really important to get lots of opinions. And then I think it's also really important to think about what your priority is. So for neuroendocrine, you have surgery, you have chemotherapy, you have radiotheranostics. Everybody pushed really hard for me to do the surgery. I think in hindsight, that probably was the right decision, but I didn't really understand what I was doing at that time and how dramatic the effect of the surgery would have on my life, maybe on my mental health. So I think you really want to make sure you've talked with plenty of people, not just doctors, but patients, and make sure you know what the pros and cons are of each, because the radiotheranostics, for me anyway, has been so easy. And if I could have just gone down the radiotheranostics route, that would have been great. I don't know that I would be where I am if I had only done one thing, but it's something that's worth considering. I pretty much went to radiotheranostics when I used every other bullet, but I don't think I would do that if I had to do it over again. I think I probably would have had the surgery and then gone right to radiotheranostics.
Do you feel that there's enough awareness and public understanding of neuroendocrine tumors or their treatment option with radiotheranostics?
Definitely not. There is, in the United States in particular, there is very limited awareness of radiotheranostics, and in particular of what's going on in other parts of the world.
Are you optimistic about the future?
I'm very optimistic about the future in radiotheranostics. So they've been doing radiotheranostics in Europe for many years, 25 years, and things have been getting better and better. They approved radiotheranostics in the United States 3 or 4 years ago. The version that they're doing there is not the version that they're doing here in Germany, and it's a big difference. What worked for me in the US Didn't work in the US, works in Germany. A couple days ago, I got a new treatment using alpha particles, which I think is the newest wave of radiotheranostics, and all the trials and results have been really good. So even though I think it's really good today, it's getting better and better and better. So I'm quite optimistic about the future and cancer treatment using radiotheranostics.